the human being is not only material level. There is an energy level and a level of the soul that is the mind or the psyche and the spirit. Illness affects these levels, the material level, the energy level or level of vital force as we call it in homeopathy, and the mental or psychological level. The illness comes from the energy level becomes disorder, and then this disorder goes up and down and gives physical level symptoms and psychological symptoms. So the first law, the law of the whole, says that when you deal with a human being, a patient, as a doctor, you have to deal with the whole. You have either in diagnosis or in treatment. So, in diagnosis you have to deal with all his symptoms, the mental and the physical and the psychological. And when you treat the patient, you have to give an energy homeopathic remedy that acts both on the physical and the psychological level. Psychosomatic medicine. The law of the whole. The law of the similar or similarity. What does it tell us, this law? It tells us that, first of all, if illness is of energy nature, you have to use similar therapeutic drugs, that is, energy homeopathic drugs. And the remedy that you will give has to be similar in nature as to the whole picture, the psychosomatic picture of the patient. This is the law of similarity. The law of similarity says that you will not deal with the disease, but you will deal with the patient as a whole and in similarity. The third law is the law of individualization. You have to individualize. You treat the patient, the person, and not the disease. A patient may come to the homeopathic doctor with 5 different diseases. A depression on the psychological level, a colitis, a common cold, an arthritis, a skin disease. You don't give 5 different remedies, homeopathic remedies. You give only the one homeopathic remedy that is similar to the patient, to this certain patient, not to the disease. It is similar, it is individualized, and it affects the whole. And then there is the law of hierarchy. Hierarchy. This law says that not all organic systems are the same in matters of importance as to the whole. First of all, there is the psychological level, which hierarchically is above the physical level. And then on the physical level, first is the central nervous system, then is the endocrine system, the hormonal system, then the lungs and the heart, all the other viscera and systems, and then in the end we have the musculoskeletal, the bones and muscles, and in the end the skin. If you have a lesion on the skin, it's no big deal. If you have the same lesion on the brain or in the heart, then you've got severe problems. When a patient comes to you with a skin problem, he is in a better health condition from one who has a problem with his stomach, from one who has a problem with his heart, from one who has a problem with his nervous system. Psychosis is a much more severe disease than depression or than phobias. A disease of the nervous system is much more severe than a disease of the heart or of the intestines or of the skin. When somebody faces physical and psychological stress, let's say someone's mother, child is involved in an accident and dies. If the parent develops a skin rash out of this shock, he is in a better health state than if he had developed gastritis, or if he had a heart attack, or he got into depression. The human system is a very wise system. It has levels of defense. The more he keeps the disorder in outer levels, in external levels, in less important for survival levels, the better its condition is. I will not get in more details. What I want to stress is that there are certain homeopathic laws that we apply in diagnosis and treatment strictly. And that's what makes homeopathy a scientific method, and especially classical miasmatic constitutional homeopathy. What are the boundaries of homeopathy? We cannot cure all patients. None of the existing therapeutic systems, or those that will be found in the future, or those that existed in the past, will cure all patients. There are no such things as panacea, as magic pills. Yet, from my clinical experience of 30 years of practice of homeopathy, I found out that homeopathy has some great advantages compared to the allopathic therapeutic system. We have much more deep results and much more permanent results. And the second great advantage is that we have no side effects at all. No side effects at all. And we don't give much drugs. We give one drug at a time for the whole patient, for all his kind of diseases. That doesn't mean that we have to be fanatical. If our main goal as doctors is the interest of the patient, then we should not be fanatical, because especially nowadays that we have so many severe and complicated problems, health problems, many times we have to use in parallel homeopathy and allopathy and acupuncture and so on. Yet, from my experience, homeopathy works and works most of the times alone. Yet, if you have to give allopathic drugs, you will give it for the good of for the benefit of the patient. We can use homeopathic drugs and allopathic drugs and acupuncture at the same time with no problem between the remedies. If a patient comes to me with certain allopathic drugs that with chronic treatments with allopathic drugs, it is wrong to stop his allopathic drugs suddenly at once. I give the homeopathic remedies also, and if the patient gets better, and after verification of this improvement with diagnostic procedure, then I gradually decrease the dosage of the allopathic drugs, and if possible stop it. And then the patient stays only with the homeopathic remedies, and then he stops them also if he gets well. There are, of course, some allopathic drugs that you should not stop. If you have a patient with a heart failure or a kidney failure, you will give those, you will never stop those remedies, those allopathic remedies that will serve his renal failure or or heart failure. It is wrong medically. So, cooperation of all the medical doctors, of all the therapeutic systems for the benefit of the patient without any fanaticism. What is the present status of homeopathy? In many countries, especially European countries or Latin America countries, several classical medical universities have created a homeopathic specialty, and doctors are trained at the university level to become homeopathic doctors. And some states in Europe and in Latin America have recognized homeopathy as a medical system and a medical specialty. In some countries, homeopathy is fully accepted in the health system of that country, that is, in hospitals, in private practice, and the insurance system covers the expenses of homeopathic treatment. The homeopathic doctors, the last 100 to 150 years that homeopathy is practiced around the world, have become associated to an international association called the Liga Medicorum Homeopathica Internationalis. LMHI. It's the International Association of the homeopathic doctors, homeopathic medical doctors, around dentists and veterinarians around the world. Some decades ago, a European Association of the medical doctors, homeopathic medical doctors, was formed, the European Committee for Homeopathy. ECH, the European Committee for Homeopathy. And it unites the homeopathic medical doctors, dentists and veterinarians in Europe. And it includes associations of homeopathic medical doctors in more than 40 associations in 25 European countries. In Greece, Homeopathic Academy our association, of which I am the president, is a non-profit homeopathic medical association, full member of the ECH, of the European Committee for Homeopathy, and our teaching center has been recognized by the European Committee for Homeopathy, and our students, after 3 years of education, if he's successful to the examinations, can receive the European Diploma for Homeopathy from the European Committee of Homeopathy. Recently, we have created the Homeopathy Data Bank of classical homeopathy. It's an electronic non-profit data bank for classical homeopathy, and any medical doctor can have an access to the data included there, or can upload his articles, researches, homeopathic medical books, and so on. And all our lessons and books are uploaded to the webpage of the Homeopathic Academy and the webpage of the Homeopathy Data Bank. Recently, we have established the Marathon International Summer School in the municipality of Marathon in Athens, in the area of Attiki, and it is the place where the marathon battle of the Greeks with the Persians took place. We have land there that hosts this summer school, and from now on, each summer, we will have summer schools for classical homeopathy. That includes lessons about classical, miasmatic, constitutional homeopathy. We have also established an e-learning project, an international e-learning project in English. These lessons done here that you watch are part of this e-learning project, and during the whole year, any medical doctor around the world can watch for free these lessons that are uploaded in the webpage of the Homeopathic Academy and the webpage of the Homeopathic Data Bank. he can correspond with our trainers, and in the summer he can attend the Marathon International Summer School. This is the first introductory lesson. We will continue with other lessons about the classical miasmatic constitutional homeopathy. I tried to give a general picture of homeopathy in medical doctors that have the first contact with homeopathy, but I believe it is always useful for any homeopathic medical doctor. Thank you for listening. See you next time.